Welcome to this brief video on the Chinese herbal formula called Angelica and Peony powder, or Danggui Shao Yao San in Chinese. This is a formula that treats pain, urinary problems and edema during pregnancy. The formula appears in Zhang Zhongjing's Essential Prescriptions from the Golden Cabinet, or Jin Gui Yao Lue. The formula is found in the last chapters of the book, in the section dealing with women's issues. Clause 5 of Chapter 20 states that if a pregnant woman experiences ulcer-like pains in the abdomen, she should use Danggui Shao Yao San. The character denoted in yellow has been used to denote sores, ulcers, or pestilence. In this case, it can be associated with continuous cramping pain and contractions. The statement in Clause 17 of Chapter 22 is more general and doesn't give further clues for its usage. Nevertheless, experience has shown that this formula is one of the safest formulas for treating pain during pregnancy. The formula is categorized as a blood tonifying formula. It is named after its two main ingredients, Chinese Angelica and Peony. Although it is called a powder, in present times it is taken as a decoction. If we compare this formula with Sheng Tang, we will see that both contain blood-nourishing and blood-moving herbs, and in each formula a blood-nourishing herb is emphasized in dosage. In Sheng Tang, Danggui is used in high dosage. It is both a blood-nourishing and a blood-moving herb. In Danggui Shao Yao San, Bai Shao is emphasized in dosage. It is a blood-nourishing herb with a special affinity for the liver. Both formulas have two herbs in common, Danggui and Sheng. This paired herb combination is excellent for moving and nourishing blood. Both formulas treat pain. Sheng Tang uses Taoren, which is a vigorous blood-moving herb. As this is for a postpartum situation, there are fewer restrictions on which herbs can be used for treating pain. Danggui Shao Yao San, in general, uses gentler herbs and can hence be used in pregnancy. As we will see later, it is actually a subtle formula that indirectly regulates liver activity by acting on the spleen. The formula consists of 6 herbs: Danggui or Chinese Angelica root, Bai Shao or white peony root, Fu Ling or poria, Baizhu or white atractylodes root, Xie or oriental water plantain, Sheng or cnidium rhizome. The formula uses 2 blood tonifying or nourishing herbs, Danggui and Bai Shao. It has 1 blood invigorating herb, Sheng. To a certain degree, Danggui is also regarded as a blood-invigorating herb. It also has 3 herbs that treat dampness, that is Fu Ling, Baizhu, and Xie. The formula uses a very high dosage of Bai Shao compared to the other herbs. The role of Bai Shao is very important for tonifying liver blood. The liver ensures the smooth flow of qi throughout the entire body. Pain is associated with impeded flow of qi or blood. Thus, Bai Shao is particularly useful for treating pain in pregnancy. This is the herb dosage as given in the Jin Gui Yao Lue. Ancient measures are a complicated topic which I will cover later, but we can see that Shao Yao or Bai Shao is assigned in higher dosage. Danggui is Chinese Angelica root and has been a popular herb for women even outside China. It has an oily texture and tends to be cut into longer, thin strips. Its properties are sweet, acrid, and warm. It is associated with the heart, liver, and spleen channels. You'll remember from the 5 transformations diagram that the sweet property is associated with the spleen channel. The characteristics of Danggui are that it both tonifies and invigorates the blood, with more emphasis on tonification. It also regulates menstruation and alleviates or stops pain. You should be careful about using Danggui if the patient suffers from diarrhea and abdominal fullness. The patient may show a tongue with a thick coating, which would imply dampness. Bai Shao is white peony root. It is produced from the roots of cultivated Peonia lactiflora with the skin removed. Its properties are bitter, sour, and mildly cold, and it is associated with the liver and spleen channels. You'll remember from the 5 transformations diagram that the sour flavor is associated with the liver. The actions of Gui Shao are that it tonifies blood and regulates menstruation. It conserves yin and stops sweat. It alleviates pain, nourishes and softens the liver, and stabilizes liver yang. Because Gui Shao is cold and inhibiting, you should be careful about prescribing it to a patient who has a weak stomach or who suffers from diarrhea. It should not be prescribed for very long periods. Fu Ling or poria is a large mushroom that grows underground on the roots of red pine trees. It looks like a coconut and has a dark brown exterior and a white interior. It is important for controlling dampness in the spleen. Although you'll often see it in cubes, the great physician Zhang Xichun preferred using it thinly sliced. The nature of Fu Ling is sweet, bland and neutral. It is associated with the heart, spleen, kidney and lungs. Fu Ling leaches dampness in the spleen, thereby allowing it to efficiently transform food nutrients into qi and blood. It is mild but recognized as being effective, and it is very often prescribed by Chinese physicians. It is also beneficial for the heart and helps treat insomnia. It should be avoided when there is yin deficiency or sunken spleen qi. Baizhu is white atractylodes root. In the Sheng Bansao it was just called zhu. This herb is frequently found in Zhangzhongjing's formulas. It is bitter, sweet and warm and associated with the spleen and stomach. Like Fu Ling, it dries dampness and disinhibits water. It checks sweating. In this formula, an important feature is that it calms the fetus. As a drying herb, it should be avoided when there is heat from yin deficiency or if fluids are exhausted. Xie is oriental water plantain or alisma rhizome. It is sweet, bland and cold, and associated with the kidneys and the bladder. This is a diuretic herb that disinhibits water and leaches out dampness. It discharges heat associated with ministerial fire and clears turbidity. Incidentally, in China it is also prescribed for weight loss. As with Fu Ling, it should be used with caution if there is sunken qi in the middle burner, an assessment that is often associated with persistent diarrhea. Chuanxiong is Sichuan lovage root or cnidium rhizome. The chuan in its name associated with the province Sichuan. It has a characteristic irregular shape with a darker margin. Its properties are acrid and warm, and it acts on the liver, gallbladder and pericardium channels. Its key characteristics are that it invigorates the blood, promotes the movement of qi and expels wind. It is very often used to treat headaches. As a blood-moving herb, Chuanxiong should be used with care during pregnancy, or if the patient bleeds easily or has profuse menses. It should not be used in cases of yin deficiency, where there is general dryness and the patient has a red, dry tongue. There are 2 sets of paired herbs in Danggui Shao Yao San. Danggui and Chuanxiong nourish and move blood, dispelling stasis and stopping pain. Baizhu and Fu Ling both treat dampness. In this way, they play an important role in supplementing the spleen, which is the source of postnatal qi and is responsible for the transportation and transformation of this qi. According to TCM theory, the biggest impediment to spleen functionality is dampness, which acts as an obstruction and arises from the incorrect processing of fluids. This dampness may be manifested by edema, which is commonly encountered in pregnancy. Baizhu supplements and dries dampness, while Fu Ling leaches dampness and frees urination. Together they diminish dampness to free the movement of qi. Danggui Shao Yao San is used for blood stagnation and damp obstruction syndrome. As a formula, it nourishes blood, regulates the liver, fortifies the spleen, resolves dampness, relaxes tension, and alleviates pain. If we look at the individual herbs that make up the formula, we can see that they're nearly all associated with the liver and the spleen, and the formula does indeed treat liver-spleen disharmony. The first clause of Zhangzhongjing's Jin Gui Yao Lue has the following dialogue. Question. The superior practitioner cures a disease before it occurs. What is the meaning of this statement? The master says, to treat a disease that has not yet occurred means that if you see a pathology in the liver, knowing that there is transmission between the liver and the spleen, first replenish the spleen. We can see Danggui Shao Yao San, which appears much later in the text, as an excellent example of how the liver can be treated by supplementing the spleen. Dr. Fang Shilun says that Zhang Zhongjing's writings belong to a different school of thought than the Huangdi Neijing. Among the differences is that for Zhang Zhongjing, the body appears more as four poles that interact and need to be balanced. In this case, the liver is suffering from blood deficiency and reacts, impeding spleen functionality. This is treated with a large dosage of baishao. The spleen is also impeded by dampness because fluids are not transformed correctly. The dampness is treated by the three drying herbs, Fu Ling, Baizhu, and Zexie. The signs and symptoms associated with Danggui Shao Yao San are a cramping, continuous pain in the abdomen, which is not too severe, difficulty in urination, and edema of the lower limbs. These are experienced during pregnancy and can be accompanied by a pale face, fatigue, and general heaviness. The tongue may be pale with a greasy white coating, and the pulse can be wiry and thin. The formula is generally mild, so there are no particular contraindications. Thank you for watching this video, and I hope you'll join me for future videos in this series.